Welcome to episode 1 of Is This Rad or Bad, where I help you understand your radiology report. Hi, I'm Dr. Robin Roth, aka the Booby Docs. I'm an associate professor of radiology specializing in breast and abdominal imaging. So let's get after it, starting with my mammogram. This is a normal study, thankfully. So under here, you'll see history. If it's screening, you should be asymptomatic, no symptoms. Here, the radiologist might include your personal and family history of breast cancer. Also, any surgical history, which is really important because that can often show up in a mammogram. We're going to compare it to last year's imaging, which is always helpful. Comparisons are so essential in all radiology studies, but especially breast imaging. Now, under here for breast composition, this is a really important section. Here is where you're going to find out if you have dense breast tissue. So the radiologist is going to assign your breast one of 4 categories. So if you see category A, fatty, or B, scattered, that means you do not have dense breast tissue, and mammogram is a great test for you. Now, if you see category C, heterogeneously dense like me, or D, extremely dense, that means that you have dense breast tissue. Dense breast tissue is common and normal. About 50% of women have dense breast tissue. It just makes it harder to see small cancers using a mammogram alone because dense breast tissue appears white on the mammogram, and so does breast cancer. So think of it like finding a snowflake in a blizzard. Also, dense breast tissue increases your risk of developing breast cancer, so it's like a double-edged sword. So you might want to consider adding ultrasound or MRI depending on your risk factors, which allows us to find smaller breast cancers in an earlier, more treatable stage. Radiologist sees no suspicious masses, calcifications, or areas of architectural distortion, which is what we're looking for on a mammogram. Those might be the earliest signs of breast cancer. Because I had dense breast tissue, I chose to get a supplemental ultrasound. That allows us to see through the breast tissue a little bit better. The radiologist sees no suspicious masses. So under here, you're going to see negative mammogram and ultrasound BI-RADS 1. So BI-RADS stands for Breast Imaging Reporting and Data Breast Imaging Reporting and Data Breast Imaging Reporting Data System. This is a code that the radiologist generates after your mammogram to indicate what the findings are and what the follow-up should be. So BI-RADS 1, which is what I got, is negative. BI-RADS 2 means it's benign. BI-RADS 3 means it's probably benign. It's a less than 2% chance of it being cancer. The radiologist will typically follow you every 6 months for 2 years, and once we establish 2-year stability, then we bless you. BI-RADS 4 means it's suspicious that it warrants a biopsy. This is anywhere between a 2 to 95% chance of it being cancer. It's a very wide range. Only about 20% of the BI-RADS 4 biopsies that we do come out to be cancer, which means that 80% of them will end up being benign. So I'm really suspicious about it. I will give a category 5. A BI-RADS 5 means that it's highly suspicious. If we do a biopsy and we get a benign result, we'll call it discordant and we'll recommend excision. And a BI-RADS 6 means that it's biopsy-proven malignancy. In some cases, we're doing neoadjuvant treatment and we're seeing if it shrinks with chemotherapy. Okay, so I saved the most important BI-RADS for last, BI-RADS 0, which is incomplete. It could be as simple as we need your old films till we see something that's abnormal that we need to work up. But either way, it is probably too early to start freaking out. I promise you my next video will be dedicated entirely to BI-RADS 0 and what a callback looks like and what the results can look like. I hope this was helpful. Please make sure you follow the Booby Docs for more of the breast information.